Ebola virus disease, EVD, was first discovered in 1976 during two simultaneous outbreaks in Nzara, South Sudan, and Yambuku, Democratic Republic of Congo, formerly Zaire. The disease was named after the Ebola River, which is near the village of Yambuku in the Democratic Republic of Congo, where one of the initial outbreaks occurred. The Ebola virus is transmitted to humans primarily through contact with infected animals, followed by human-to-human transmission. Here is an overview of the infection route. Animal-to-human transmission. The Ebola virus is believed to be hosted by fruit bats in the Pteropodidae family, which are considered natural reservoirs of the virus. Humans can become infected through direct contact with blood, bodily fluids, or tissues of infected animals, such as fruit bats, non-human primates, e.g., monkeys and apes, or forest antelopes. Infections can occur during hunting, butchering, or handling of infected animals or their raw meat, bushmeat. Human-to-human transmission. Once a person is infected with the Ebola virus, the disease can spread to others through direct contact with the infected individual's blood or bodily fluids, such as vomit, feces, urine, sweat, saliva, breast milk, or semen. The virus can also be transmitted through contact with contaminated objects, such as needles, syringes, clothing, or bedding. Transmission through broken skin or mucous membranes. The Ebola virus can enter the body through broken skin or mucous membranes, such as the eyes, nose, or mouth. Healthcare workers, family members, or individuals caring for EVD patients are at a higher risk of infection if they do not use appropriate personal protective equipment, PPE, or follow strict infection control measures. Sexual transmission. The Ebola virus can persist in semen for several months after recovery from the disease. Therefore, sexual transmission is possible, and survivors are advised to practice safe sex or abstain from sexual activities for a specific period following recovery. It is important to note that the Ebola virus is not spread through the air, and casual contact with an infected individual, such as touching or being near them without direct contact with their bodily fluids, is unlikely to result in infection. Symptoms of Ebola virus disease, EVD, typically appear between 2 to 21 days after exposure to the virus. The symptoms can be sudden and severe, often starting with flu-like signs and progressing to more serious complications. The symptoms include fever. A high fever, often greater than 100.4 degrees Fahrenheit, 38 degrees Celsius, is one of the initial symptoms of Ebola virus disease. Severe headache. People with EVD frequently experience intense headaches. Muscle pain. Muscle aches and weakness are common early symptoms. Fatigue. Extreme tiredness is often reported in individuals infected with the Ebola virus. Sore throat. A sore throat can be one of the early signs of the disease. Vomiting. As the disease progresses, patients may experience episodes of vomiting. Diarrhea. Diarrhea is another common symptom of EVD. Abdominal pain. Patients may report pain in the abdomen. Rash. A maculopapular rash, characterized by flat, red areas on the skin covered with small, raised bumps, may develop on the body. Impaired kidney and liver function. The Ebola virus can affect kidney and liver function, leading to elevated levels of certain enzymes in the blood. Internal and external bleeding. In severe cases, patients may experience bleeding from the gums, nose, or injection sites, as well as internal bleeding, such as in the gastrointestinal tract or lungs. However, this symptom is less common than previously believed and occurs in only a minority of cases. It is important to note that early symptoms of EVD can resemble other infectious diseases, such as influenza, malaria, or typhoid fever. Confirmation of an Ebola virus infection requires laboratory testing. Prompt medical attention and supportive care are crucial for improving the chances of survival. There is currently no specific antiviral treatment proven to be effective against Ebola virus disease, EVD. The main approach to treating EVD involves supportive care, which aims to manage symptoms, maintain vital functions, and improve the patient's chances of survival. Supportive care for EVD may include rehydration. Dehydration is a common complication of EVD due to vomiting, diarrhea, and fever. Oral rehydration solutions or intravenous fluids may be administered to maintain the patient's fluid and electrolyte balance. Maintaining blood pressure. Patients with EVD may experience low blood pressure, hypotension, as a result of fluid loss. Intravenous fluids and medications may be used to support blood pressure. Oxygen therapy. Patients with breathing difficulties or low oxygen levels may require supplemental oxygen. Pain management. Pain relievers, such as acetaminophen or ibuprofen, may be administered to manage pain associated with headaches, muscle aches, or abdominal pain. Treatment of secondary infections. Patients with EVD are more susceptible to secondary infections due to a weakened immune system. Antibiotics or antifungal medications may be prescribed if additional infections are identified. Blood transfusions. In some cases, patients with severe bleeding or anemia may require blood transfusions. Organ support. In severe cases, when organ failure occurs, patients may require support from machines, such as dialysis for kidney failure or mechanical ventilation for respiratory failure. Monitoring and managing electrolyte imbalances. Electrolyte imbalances, such as low potassium or calcium levels, may need to be corrected with supplements or medications. In addition to supportive care, experimental treatments have been used during outbreaks, including antiviral drugs and monoclonal antibodies. In 2020, the U.S. Food and Drug Administration, FDA, approved Inmazeb, a combination of 3 monoclonal antibodies, for the treatment of EVD caused by the Zaire Ebola virus. More research is needed to determine the most effective treatment options for EVD. Vaccination also plays a role in preventing and controlling Ebola outbreaks. The RVSV-ZEBOV vaccine, which has demonstrated high efficacy in preventing infection, was pre-qualified by the World Health Organization, WHO, in 2019. Ebola virus disease, EVD, is a severe and often fatal illness that can spread rapidly. However, there are several ways to prevent the spread of the Ebola virus. Practice good hygiene. Regularly washing your hands with soap and water is one of the best ways to prevent the spread of the Ebola virus. You should also avoid touching your face, especially your mouth, nose, and eyes, as this can provide a pathway for the virus to enter your body. Avoid contact with infected individuals. Ebola virus spreads through direct contact with bodily fluids of infected individuals, including blood, saliva, sweat, vomit, feces, urine, breast milk, and semen. You should avoid contact with infected individuals, particularly if they are showing symptoms of EVD. Follow infection control procedures. Healthcare workers should follow strict infection control procedures when caring for patients with EVD, including using personal protective equipment, PPE, such as gloves, masks, gowns, and goggles. Practice safe burial procedures. Ebola virus can remain active in the body of a deceased individual, so safe burial procedures should be followed to prevent the spread of the virus. This includes using appropriate PPE and avoiding direct contact with the body. Seek medical attention. If you have been in contact with an infected individual or are showing symptoms of EVD, it is important to seek medical attention immediately. Early diagnosis and treatment can improve your chances of survival. Vaccination. There is currently a vaccine available that provides protection against Ebola virus disease. People who are at high risk of contracting EVD, such as healthcare workers, should consider getting vaccinated. By following these preventive measures, we can reduce the risk of spreading the Ebola virus and help to control outbreaks of EVD.